What's up guys, welcome back to my channel PA Study Buddy. In today's video we'll continue with these PANCE high yield fast memory recall questions. The first video had some great reviews and I was asked to do some more, but as a reminder, these are the questions from my PA Study Buddy PANCE and PANRE book, which has over 3,000 questions just like this. These are the questions that I studied when I was preparing to take my PANCE. It helped me reduce anxiety, it helped me prepare better for my test, and I did great on it. So we'll start with the first question, but before we do that, for those of you that are back to my channel, thank you for support. For those of you that are new, look around, see if there's other helpful videos you may find. Please go ahead and hit that like button, hit that subscribe button, help me grow this channel. Leave a comment, tell me what you think about the video. It helps my algorithm and I truly appreciate it. So the first question is, Lyme disease is associated with which erythema? This would be erythema migrans. It's the expanding, warm, annular, meaning circular, erythematous rash with a central clearing. So think bullseye. If they say bullseye rash, you should be thinking erythema migrans. Should be associating that with the Lyme disease. Barking cough in a kid, you should be thinking about croup. They may also indicate a steeple sign that is seen on an X-ray. Most common sinus involved with the orbital sinusitis. That would be the ethmoid sinus. Which medication is used for treatment of bedwetting? That would be DDAVP, Desmopressin. DDAVP is also used in the patients with a DI to help reduce the sodium. What are the chances that a baby will be getting a HSV2 from a mom during the delivery? It is a 50% chance. Eczema herpeticus treatment is IV acyclovir. So hypomanic versus manic episode in a time frame. For a hypomanic is at least 4 days, where manic is at least 1 week long. Bipolar 2 is defined as one or more depressive episodes and at least one hypomanic episode. Most common ECG finding of irregular rhythm. When you talk about irregular rhythm, you should be thinking about AFib, and you can see how it's like irregularly spaced out. That should make you think about AFib. A most common location for re-entral SVT, supraventricular tachycardia. That would be the AB node. Clozapine is the most effective antipsychotic but carries the risk for. So this is the kind of question when they tell you patient is psychotic, so forth. They're taking clozapine. I always had issues with saying the pharmaceutical drug names. Clozapine is the most effective antipsychotic, and they may ask you what's the most common side effect, and that is agranulocytosis. Agranulocytosis is a condition where the absolute neutrophil count is less than 100 per microliter of blood. So they may tell you this patient is taking clozapine, and they may tell you the CBC and tell you the blood count. If it talks about agranulocytosis, is the answer you're looking for. Most common condition accompanying pericarditis. That would be pericardial effusion. Most common cause of death due to endocarditis. Congestive heart failure. A bonus question is, what would you see on a congestive heart failure chest x-ray? I posted another video of radiology findings that are super helpful for PANCE and for clinical rotation, and I talked about congestive heart failure in that video. But you're looking for a bat wing signs, you're looking for a lot of congestion throughout the lungs. Schizophrenia positive symptoms are hallucinations, delusions, ideas of reference, disorganized speech, and general and incoherent thoughts. Schizophrenia negative symptoms are, and you guys should, if I'm going too fast with giving out the answers, feel free to pause the video, give your answer, and then continue. Lack of emotional response, a flat affect, alogia, apathy, avulsion, and blunting. And here's a nice little diagram showing the positive signs versus negative signs. Positive, again, delusion, hallucinations, disorganized speech. Negative would be flattened affect, reduced speech, and lack of initiative. Dysthymic disorder is, what is dysthymic disorder? It's a depressed mood for most of the days. They feel like depressed almost every day, and it lasts for at least 2 years. Most common cause of croup, parainfluenza virus. Drug of choice for pertussis, the whooping cough, is a macrolides, azithromycin, erythromycin, clarithromycin, any mycin. When you think about whooping cough, think mycin. It's caused by Bordetella, pertussis. There's 3 phases: catarrhal, paroxysmal, and coalescent. What is the Samter triad? So Samter triad is aspirin sensitivity, nasal polyposis, and asthma. Aspirin sensitivity, nasal polyposis, and asthma. Most common used substance for what is the most common used substance by schizophrenics? Nicotine. The question you may encounter is they tell you the patient is schizophrenic, and they may tell you that he's taking clozapine and that he's a current smoker, and what is the risk of that? The risk is that nicotine reduces the clozapine level. So they'll tell you the clozapine will stay the same, it will increase, it will decrease, blah, blah, blah. Just look for a decrease in the clozapine level. Most common symptoms of the community-acquired pneumonia: cough with a purulent sputum, fever, and dyspnea. What is the most common nosocomial infection? So nosocomial, like we all know, these are the hospital-acquired infections, and the most common infection acquired in a hospital is UTI, and the second will be hospital-acquired pneumonia. What is the most common organism to develop abscess aside from the skin? So we are always common seeing abscesses on the skin, but what is the next most common organ that can develop the abscess? That would be the liver. And in this CT, you can see that gigantic abscess in the liver. What is the most common presenting symptom of the liver abscess? So when they may tell you the patient has liver abscess, they may even show you the images, and when they ask you what is the most common presenting symptom, it should be fever. Most common cause of infectious diarrhea in children. So they'll give you a stem with a young child who has an diarrhea and figure it's infectious, and they'll ask you what is the most common cause, and that is rotavirus. What is the most common reason to give statins at night? Because the statins are given at night because the cholesterol synthesizes at night. Most common side effects of statins. There's a question when they tell you the patient has, atherosclerosis, you may have this or that, hyperlipidemia, and they're on the statins, and they want to see if you know what are the side effects of the statin medication, and most common side effects are muscle pain and soreness. What is the most common medication used to decrease triglycerides? That would be fibric acid derivatives, fenofibrate, and gemfibrozole. Most common risk of increased triglycerides. So if a patient has triglycerides that are super high, they are increased risk of developing acute pancreatitis. What are the side effects of fibric acid derivatives? Dyspepsia, nausea, vomiting, gallstones, and myopathy. Once again, guys, if you haven't subscribed to my channel, please go and hit that subscribe button and help me grow my channel. I hope you find these questions helpful, and I will continue to bring these videos, and hopefully it helps you get that big C, baby. Question 31. Most common meds used to treat cholesterol in pregnancy. So they'll give you a stem They'll give you a stem and tell you a patient is pregnant and the patient has a high cholesterol, and they'll give you a choice of medications and ask you to pick one. And the choice of meds for cholesterol in pregnancy is bile acid sequestrants. So that will be cholestyramine. Like I said, the drug names are just something that I'm still having a hard time with. Bile acid sequesters, cholestyramine. Most common med used to increase HDL. So HDL is a good cholesterol and we want it high, and the most common med used to increase it is niacin, vitamin B3. The question you may commonly see on your tests is what is the most common adverse effect of niacin? And they'll give you a stem, they'll tell you the patient has low HDL, they'll tell you the patient is taking niacin, and they'll ask you what's the most common adverse effect, and that is flushing. So they'll tell you the patient, or maybe they tell you the patient is flushing after starting a new medication, and they ask you what kind of medication that is, and you should be thinking about niacin. What are some contraindications to prescribing niacin? You should not prescribe a niacin to patients who have liver disease, who has severe gout, and peptic ulcer disease. Most common cause of inflammatory enteritis, that would be Campylobacter jejuni. Most common cause of UTI, it is E. coli. Most common cause of septic arthritis, Staph aureus. What are the most common locations of the septic arthritis? That would be the knee and a hip. Most common reason for septic arthritis in SI joints. The question may tell you the patient has septic arthritis in SI joints, and they'll give you certain medical conditions the patient has, but the most common reason would be IV drug use. Most common organism in acute osteomyelitis. This will be the Staph aureus as well. Most common cancers causing fever of unknown origin. Fevers of unknown origin are likely caused by leukemia and lymphomas. What is the test of choice for DVT? That would be a Doppler ultrasound. What is the most common place for AAA? So they may tell you the patient has a AAA, they may give you a stem that talks about, AAA, and they'll give you different locations of the vessels and ask you what is the most common place. And the most common place is below the renal vessels. Which schizophrenic type has the best prognosis? The best prognosis has schizophrenic patients that is paranoid, and the worst is disorganized type. Best medications for schizoaffective disorder: haloperidol or risperidone. Should schizoaffective patients be admitted? So there's a question when they tell you the patient is, or you figure out the patient is schizoaffective, and they ask you what's the next best step in the treatment of this patient. Should they be hospitalized? They'll tell you yes, no, whatever choices might be, but the answer is usually schizoaffective patients should not be hospitalized unless they're a danger to themselves or others, in which case you want to admit them. What's the conversion disorder? A conversion disorder is a voluntary motor or a sensory deficit that suggests a neurological condition, but they are medically unexplainable. Usually they are preceded by psychological distress. Kawasaki disease is the most common in which patient population? So they may tell you patient is having fever, having these and those symptoms, and they ask you out of this patient population who is the most likely to get Kawasaki disease, and the answer is the Asian kids under the age of 5. So to suspect Kawasaki disease, the fever in a child should be present for at least how many days? At least 5 days. If the question talks about a fever that lasts for 7 days, you should be looking for Kawasaki in your answers. Question number 50. Imagined or exaggerated defect in a physical appearance should make you think of which disorder? That would be body dysmorphic disorder. Alright guys, that brings us at the end of this video. These were another 50 high yield memory recall questions. So if you find these questions helpful, go ahead and check out my book. It's on Amazon. It's like $20. It has more than 3,000 questions just like this. Go ahead and subscribe to my channel, help me grow it. I wish you all the best in your exam. You will do great. You will get that big C and you will do just fine. Just remember, thousands and thousands of people have taken this exam before you, and you will do just fine, just like the rest of us. Good luck, guys. See you soon.